Welcome back to Lender Brothers Veterinary Centre's Arthritis Talk. We've been through A to C, now we're on D. D is for disease modification. It's about controlling the changes in the joint. Here we have our bone and the cartilage that covers the end of the bone. Now cartilage has that important role of making the bones glide over each other, their frictionless surface, but it also acts as a shock absorber, and this is down to its structure. We can think of it very much like this lattice garden structure. You can see there that that would take a lot of force at the top and it would spring back again. And if we zoom in at the microscopic level, we can think of cartilage very much like a forest. And if the ground is the bone, the cartilage is anchored to that bone by the tree trunks of hyaluronic acid. Branching off this, we have protein, and on those protein branches, we have glycosaminoglycans, or GAGs. And this is something that a lot of people have heard of. Glucosamine is a GAG, and it's a supplement that we use in arthritic cases and also in growing animals to keep those joints healthy. Now, if we zoom out and look at the surface of the forest or the cartilage, that's what we see. We see this glistening surface of cartilage, which is the GAGs, the spongy layer on the top. But that's only there because we have the forest underneath it. We have those tree trunks and we have those branches. Because once you lose that underlying structure, once you lose the cartilage, there is no point in throwing glucosamine at this forest or this arthritic joint because there's nothing for it to stick to. The whole underlying structure is gone. The underlying message really is that early intervention is paramount to preserve as much normal tissue as possible. So let's talk about these GAGs, when to use them. We need to use them early enough when there is still cartilage present, and we need to sort of supplement that joint with additional nutrition. Now these are nutraceuticals. They are basically nutritional supplements. They're not pharmaceuticals, which are governed by very strict laws. Any drugs or pharmaceuticals are basically guaranteed to have what they say on the bottle. This is not the same with nutraceuticals, so use a very good quality one or a well-known brand to make sure that you don't buy just any old rubbish. Or use a very good diet. The veterinary recommended diets that we have here at the practice have all of these things in them anyway, from natural sources. Fish proteins are very high in GAGs, glucosamine and other things like chondroitin. So whenever we have a veterinary recommended diet, it's got all these additional benefits. And large breed dogs, we have on a special diet that has a higher proportion of these things because they have a greater requirement for joint health, because they're more likely to have more joint problems as they're older. There are also specialised diets for dogs and cats that have got arthritis already, and as part of the disease modification process, we will be inclined to change these animals onto a diet that has other things in them like high omega-3 fats, which act as an anti-inflammatory in the joints and also have all of these other nutritional sort of benefits as well. Additionally, there is a disease modification medication that we give by injection. This helps reduce the pain in joints, not by being a painkiller, but by improving the joint health. And it's one of the drugs that we commonly reach for whenever we find an early arthritic case. So if there is plenty of cartilage left and we want to maintain its health, we can do that by increasing the blood flow to the damaged tissue, and this is how this compound works. It increases the viscosity of the joint fluid, that synovial fluid that acts as a lubricant that also feeds the cartilage. It's a very safe treatment and we use it in a huge number of dogs very successfully. Thanks for watching this video. We've got one more, which is E.